Immediate first aid for dog bites. If a dog bite occurs, immediate first aid is vital to minimize the risk of infection and complications. Follow these steps. Wash the wound gently with soap and water to reduce the risk of infection. Apply direct pressure with a clean cloth to control bleeding, if any. Elevate the affected area if possible. Cover the wound with a sterile bandage or clean cloth. Seek medical attention, especially if the wound is deep, large, or shows signs of infection. Medical assessment and treatment. A prompt medical evaluation is essential, even for seemingly minor dog bites. A healthcare professional will assess the wound's severity, potential risk of infection, and the need for tetanus vaccination or antibiotics. In some cases, they may recommend rabies prophylaxis depending on the dog's vaccination status and the risk of rabies exposure. Monitoring for complications. Following medical treatment, closely monitor the wound for signs of infection, such as increased redness, swelling, warmth, or pus formation. Seek immediate medical attention if any complications arise. Remember, responsible pet ownership, education, and awareness are key factors in reducing the incidence of dog bites and fostering a safe environment for both humans and dogs. By working together, we can promote a harmonious relationship between people and their furry companions while minimizing the risk of dog bite injuries. Thank you for watching. Please like, share, and subscribe for more information.